Today marks a new chapter in our fight against this virus. Ever since the pandemic hit our shores almost a year ago, we have known that a vaccine would be critical to set us free. So all through this arduous year, and it has been an arduous year, while we've been working night and day to fight the virus and keep it under control, we've been striving to develop the vaccines that can give us hope and let us eventually release the curbs on our freedoms that have bound us for so long. Thanks to the incredible work of the Vaccines Task Force, the Business Secretary, and Kate Bingham, we've already amassed a huge portfolio of different vaccine candidates. We've backed 7 vaccines and ordered 357 million doses on behalf of the whole UK, one of the biggest portfolios per capita in the world. We've said from the start that a vaccine must be safe and effective before we'd even consider deploying it. Any vaccine must go through a rigorous process of clinical trials involving thousands of people and extensive independent scrutiny from the MHRA, one of the world's most respected medical regulators. Today, I'm delighted to inform the House that the MHRA has issued the clinical authorization of the Pfizer BioNTech vaccine. This is a monumental step forward. It's no longer if there's going to be a vaccine, it's when. In our battle against the virus, help is on its way. Today is a triumph for all those who believe in science, a triumph for ingenuity, a triumph for humanity, and I want to thank everyone who's played their part in this achievement. The team at Pfizer, the team of scientists at BioNTech, the volunteers who stepped up and took part in clinical trials, and to the MHRA themselves, who've made sure that this is a vaccine that we can all have faith in. Thanks to their efforts, I can confirm that the UK is the first country in the world to have a clinically approved coronavirus vaccine for supply. And now our task is to make use of the fruits of this scientific endeavour to save lives. Mr. Speaker, we've spent months preparing for this day so that as soon as we got the green light, we would be ready to go. We were the first country in the world to pre-order supplies of this successful vaccine, and we have 40 million doses pre-ordered for delivery over the coming months, enough for 20 million people because 2 jabs are required for each. Following authorization, the next stage is to test each batch of the vaccine for safety, and I can confirm that batch testing has been completed this morning for the first deployment of 800,000 doses of the vaccine. These doses are for the whole United Kingdom. This morning I chaired a meeting of health ministers from the devolved administrations to ensure the rollout is coordinated nationwide. This will be one of the biggest civilian logistical efforts that we've faced as a nation. It will be difficult. There will be challenges and complications, but I know that the NHS is equal to the task. Rolling out the vaccine, free at the point of delivery, according to clinical need, not ability to pay, is in the finest tradition of our National Health Service. And I'm delighted to confirm that the NHS will be able to start vaccinating from early next week. The whole purpose of the vaccine is to protect people from COVID so we can get lives back to normal. So we will prioritise the groups who are at greatest risk. This morning, the Joint Committee on Vaccination and Immunisation has published its advice, setting out the order of priority according to that clinical need. And this includes the care home residents and their carers, the over 80s, the frontline health and social care workers, and we will deliver according to clinical prioritisation and operational necessity because of the need to hold the vaccine at -70. It makes this vaccine particularly challenging to deploy. And while we begin vaccination next week, the bulk of the vaccinations will be in the new year, but I would urge anyone called forward for vaccination by the NHS to respond quickly to protect themselves, their loved ones, and their community. Mr. Speaker, over the next few months, we will see vaccines delivered in 3 different ways. First, we will begin vaccinations in hospital hubs. Second, we'll deploy through local community services, including GPs and, in due course, pharmacies too. And third, we'll stand up vaccination centres in conference centres and sports venues, for example, to vaccinate large numbers of people as more vaccines come on stream. This is an important step. but we are not there yet. And so I want to stress that we must all keep playing our part, keep following the new rules that the House approved overwhelmingly yesterday, and remember the basics like hands, face, space, and get a test that we know from experience are so important in keeping the virus under control. Before I finish, Mr. Speaker, may I also update the House on another bit of good news? From today, I'm absolutely thrilled to say that we can safely allow visits in care homes for those who test negative for COVID-19. Coronavirus has denied so many people the simple pleasure of seeing a loved one, which is so precious to so many, especially in our care homes. This is only possible because of the success we've had in building one of the biggest testing capacities in Europe and working with local and national teams working together side by side, something we've often discussed right across this House. We've worked hard on testing, we've worked hard on the vaccine. Our strategy of suppressing the virus until a vaccine can make us safe, that strategy is working. And I'm delighted that we'll be able to see families and friends come together ahead of Christmas, thanks to this improvement. Mr. Speaker, this is a day to remember, frankly, in a year to forget. We can see the way out of this, but we're not there yet. So let's keep our resolve, keep doing our bit to keep people safe until science can make us free.